The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the complex world of healthcare each week. My name is Marc Ryan, and thanks to everyone for listening in. We're coming off a few weeks of conferences, including the HIMSS Technology Conference and one held at CMS headquarters in Maryland. Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz was a speaker at each conference and gave his vision for healthcare reform in America, discussing a great deal of the accomplishments over the past year of Trump 47 and what the plans are for the future. Thus, I am titling this podcast, Dr. Oz's CMS Revolution, What Could Be a Watershed Moment in American Healthcare. We will take our usual 3 breaks, so let's get right into it. Let's get to part 1, a CMS that looks very different. Let's not sugarcoat it. Oz's tone, the philosophy, the urgency, all of it marks a sharp departure from the Joe Biden era. But what may be even more striking is the contrast with the first administration of Donald Trump. Because while there are similarities between Trump 45 and Trump 47, this time everything feels amplified. More aggressive, more expansive, more willing to take risks. Part of that is Dr. Oz himself. He brings a very particular mix: media-savvy communication, clinical framing, and a clear belief that the system is not just flawed, but fundamentally misaligned. And part of it is a second-term administration that now understands how to actually pull the levers of government. If Trump 45 tested ideas, Trump 47 is trying to execute them at scale. Foremost on Oz's mind is technology. At HIMSS, Oz went all in on AI, agentic AI, and digital health, and he doubled down at the CMS Quality Conference. His message: technology is no longer a support tool, it's the core strategy. He pointed to 3 pressure points: disease exacerbation, rural access gaps, weak engagement in preventative care. And he argued that technology can address all 3 simultaneously. Let's step back for a moment and cover how the system is under severe strain. Healthcare spending is projected to grow at roughly 7% annually over the next decade. That's not sustainable. That's a warning sign. So when you hear Oz talk about transformation, understand the context. This isn't optional reform. This is system survival. With that, we will take our first break, and when we come back, we will dive into some of the details. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We are talking about the new strategic healthcare direction of Trump 47 and Dr. Mehmet Oz's CMS. So here are some of the details. Let's get to part 2, quality, prevention, and the technology bet. First, the quality obsession. Oz is clearly obsessed with one thing: quality. And he's not wrong to be, because in healthcare, poor quality doesn't just harm patients, it drives costs. Think about it. Misdiagnoses lead to unnecessary procedures. Poor chronic care management leads to hospitalizations. Fragmented care leads to duplication. So when Oz says bad quality care is the biggest problem, what he's really saying is cost is a symptom. Quality is the disease. Now layer in another Oz obsession, primary care and prevention. Oz called out what he sees as a major misconception, that people who don't use healthcare are healthy. But data tells a different story. These individuals often avoid the system, present later with more severe conditions, and drive higher downstream costs. And the numbers back it up. People who do not seek out care early end up costing the system more money, not less. And data also show that primary care and prevention investments reduce overall spending. Direct primary care models show 10 to 15% savings. A Wakely analysis found that Medicare patients engaged in wellness visits save about $885 annually. That's just not a clinical insight, that's a financial strategy. Back to technology. Oz wants technology transformation and to move from ideas to implementation. CMS isn't just talking about technology, it's building payment models around it. The flagship, the just announced Access model. This model links digital health companies and Medicare fee-for-service providers to deliver remote monitoring and continuous chronic care management. And then there are Elevate and Tempo, expanding this concept further. Why does all this matter? Because Medicare fee-for-service was built for a different era. It rewards visits, volume, and procedures, not prevention, monitoring, or avoided complications. So this isn't just innovation, it's an attempt to rewrite the rules of reimbursement over time. Oz sees technology playing a huge role in the rural health crisis as well. Rural health has seen the crisis for years. Hospital closures, provider shortages, limited access to specialty care, and recent Medicaid funding pressures tied to the One Big Beautiful Bill Act could make things worse. In response, the administration has launched a $50 billion 5-year rural initiative. This was included in the One Big Beautiful Bill Act, which actually cut Medicaid and exchanges by over $1 trillion over 10 years. The focus of the Rural Transformation Program is digital access, telehealth expansion, new models for specialty and urgent care coverage. With that, we will take our second break, and when we come back, we will cover some of the major drug price reforms that are in flight. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We are talking about the new strategic healthcare direction of Trump 47 and Dr. Mehmet Oz's CMS. One big initiative has been drug price reform. So here is part 3, drug pricing and GLP-1 expansion. This may be the most consequential and politically charged piece of the agenda. A SWAT team approach. Unlike past administrations, this isn't a single reform effort. It's a coordinated, multi-pronged strategy. Executive orders on transparency across the drug channel, efforts to implement most favored nation pricing, direct negotiations with major manufacturers, and a new 5-year MFN payment model across Medicare and Medicaid, even building on the framework created under the Inflation Reduction Act under the Biden administration. When this administration took over, reported price concessions and negotiations doubled. Now, to be fair, this prior administration had limited time to execute negotiations, but it just shows how invested the Trump administration is in reducing drug pricing. But the scale and speed now is different. Most favored nation pricing is simple in concept, but profound in impact. It says the U.S. should not pay more for drugs than other developed countries. Given that Americans often pay the highest prices globally, this is potentially transformative. No, the commercial world is not touched, and it will take a while to get to full MFN in Medicaid and Medicare. But I go back to the sweeping nature of what Trump is trying to do. It simply was not accomplished by any other president. Then there's the related issue of GLP-1 coverage. The administration has proposed expanding coverage of these weight loss drugs in Medicare and Medicaid for obesity beginning in mid-2026. Before, the drugs were only available if someone had another disease state as well. That's a big deal because it reframes obesity as a primary treatment target, a driver of long-term costs. But it also raises complex questions. Can the system absorb the cost at scale? Will utilization surge? How do we define appropriate use? Still, it signals a willingness to rethink what healthcare should pay for. And the fact that drug prices for such weight loss drugs are now going to be demonstrably lower than before means the policy change is worth a chance. Now to part 4, fraud, value-based care, in the ACA reset. Let's first tackle fraud, waste, and abuse. It's back in focus. Oz is putting fraud, waste, and abuse front and center. Enforcement is dramatically up with record recoveries of late. Other key initiatives include reforming prior authorization in Medicare fee-for-service to reduce waste, broader prior auth alignment across payers. Oz sees the disparate approaches across payers and business lines as wasteful, and aggressive RADV audits in Medicare Advantage. Risk adjustment data validation audits are designed to ensure plans aren't inflating risk scores to boost payments, but implementation may be slowed due to a recent federal court ruling affecting the audit framework. With that, we will take our last break, and when we come back, we will talk value-based care. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. We are talking about the new strategic healthcare direction of Trump 47 and Dr. Mehmet Oz's CMS. If technology is top of mind for Oz, so is value-based care and payment transformation. Value-based care has been the holy grail of CMS for years. Pay for outcomes, not volume. But the results? Mixed at best. Some savings, some improvements, but not the sweeping transformation many hoped for. And yet Oz is pushing forward with even more models. That's notable because some experts, including me, argue CMS should simplify, standardize, and focus. Instead, this administration is expanding experimentation. The philosophy seems to be test everything, scale what works. It is not a bad idea, and I am very excited by some of the models announced, especially tech-based ones such as Access. Finally, let's cover the ACA overall. That is now in flight. It is a fundamental shift for employer coverage and benefits in the exchanges. There is no doubt this is a flashpoint. Under this prior approach, Biden was focused on richer benefits, strong subsidies, comprehensive coverage. But there was also rising premiums and growing affordability challenges. Now, the Trump administration is moving forward, but in a very different direction. Lower cost plan options, expansion of direct primary care, greater use of health savings accounts, broader eligibility for catastrophic plans, even allowing non-network plans to qualify as health plans that meet the Affordable Care Act standards. But there is a trade-off. This is where the debate gets intense. Supporters of these reforms say the system is unsustainable and we need affordable options. Critics argue this could weaken coverage and destabilize risk pools. True, but it is hard to argue that new ideas aren't needed. After all, employer coverage has now hit over $9,000 for each individual covered and almost $27,000 per family. Here are my final thoughts. A system at a crossroads. At the end of the day, the U.S. healthcare system is heading toward a fiscal cliff. And What we're seeing now is an attempt to change course quickly and dramatically. This is a bet on technology, a bet on market forces, a bet on consumer engagement. It's bold, it's controversial, and it may define the next era of American healthcare. But it is also not without its own risks in some areas, especially on the benefits front where there could be disruption. But there's no escaping that some disruption may be needed, given a severe lack of affordability. Thanks for listening to the Healthcare Labyrinth podcast. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.